Your stomach is literally screaming at you right now, and you're just popping antacids like candy, hoping it'll go away. That burning sensation, that constant discomfort, that feeling like your stomach is waging war against you, that's not normal, and ignoring it could lead to serious complications that are much harder to reverse. As a medical doctor, I see patients every single week who waited too long to address their gastritis, and by the time they come to me, what could have been a simple fix has turned into a chronic nightmare. Today I'm going to show you exactly what your stomach is trying to tell you and why you need to pay attention right now. Before we dive in, drop a comment below and be honest with me. How long have you been ignoring your stomach symptoms? Days, weeks, months, years? And what's the main symptom that's been bothering you the most? I read every comment, and your feedback helps me create content that addresses your specific struggles. Let me start by explaining what gastritis actually is, because most people have no clue what's happening inside their body. Gastritis is inflammation of your stomach lining, the protective mucous membrane that shields your stomach walls from the corrosive acid your body produces to digest food. Think of your stomach lining like the protective coating inside a paint can. When that coating gets damaged or worn away, the acid starts eating through the metal underneath. That's exactly what's happening in your stomach when you have gastritis. The protective barrier is compromised, and now your stomach acid is damaging the tissue underneath. Here's what most people don't realize. Gastritis doesn't just appear out of nowhere. Your body has been sending you warning signals for weeks or even months before it gets bad enough to make you really uncomfortable. But we're so good at ignoring our bodies, popping pills to mask symptoms, and pushing through the discomfort that we miss all the early warning signs. Let's talk about those warning signs your stomach has been desperately trying to communicate. The most obvious one is that burning or gnawing pain in your upper abdomen. This isn't just random discomfort. This is your stomach lining literally being irritated and inflamed. The pain might come and go, it might get worse between meals when your stomach is empty, or it might flare up after eating certain foods. But here's where it gets tricky. Some people with gastritis don't feel pain at all. Instead, they experience what we call silent gastritis, where the inflammation is there, but the pain signals aren't as obvious. These people might just feel a vague sense of fullness, mild nausea, or general digestive discomfort that they brush off as no big deal. Bloating and excessive gas are huge red flags that most people completely ignore. You're not just bloated because you ate too much. When your stomach lining is inflamed, your digestive process becomes inefficient. Food sits in your stomach longer than it should, ferments, produces gas, and creates that uncomfortable bloated feeling that makes you want to unbutton your pants. Nausea, especially in the morning or when your stomach is empty, is your body's way of saying something is seriously wrong. Morning nausea with gastritis happens because stomach acid has been irritating your inflamed lining all night while you were sleeping. Your body responds with nausea as a protective mechanism. Loss of appetite or feeling full quickly after eating just a small amount is another critical warning sign. Your stomach is inflamed and sensitive, so it's sending signals to your brain saying, "Stop eating. We can't handle this right now." People often think they're just stressed or not hungry, but this is actually your stomach's defense mechanism. Indigestion that happens regularly, not just occasionally, is a massive red flag. We're talking about that uncomfortable feeling of food just sitting in your stomach like a rock, accompanied by burning, belching, and general digestive distress. This isn't normal, and it's not something you should just accept as part of your life. Vomiting, especially if you see blood or what looks like coffee grounds in your vomit, is an emergency situation. This means your gastritis has progressed to the point where your stomach lining is actually bleeding. Coffee ground appearance happens because your stomach acid has partially digested the blood. If you're experiencing this, you need medical attention immediately. Dark tarry stools are another emergency sign that your gastritis has caused bleeding. When blood passes through your entire digestive system, it turns black and makes your stool look like tar. This is not something you wait on. This requires immediate medical evaluation. Now let's talk about what causes gastritis in the first place, because understanding the cause is crucial for healing. The number one culprit in most cases is Helicobacter pylori bacteria. This sneaky little organism burrows into your stomach lining and creates chronic inflammation. It's estimated that about half the world's population has H. pylori, but not everyone develops symptoms. H. pylori weakens your stomach's protective mucus layer and allows acid to damage the underlying tissue. It also produces enzymes and toxins that directly damage stomach cells. If you have chronic gastritis that won't go away no matter what you do, H. pylori is likely the hidden culprit, and you need proper testing and treatment. Non-steroidal anti-inflammatory drugs are the second most common cause of gastritis. We're talking about ibuprofen, aspirin, naproxen, and similar medications. These drugs work by blocking enzymes called COX-1 and COX-2. The problem is, COX-1 is responsible for producing prostaglandins that protect your stomach lining. When you block COX-1, you reduce stomach protection while your stomach continues producing acid at normal levels. It's like removing your armor while walking into battle. Taking these medications regularly, especially on an empty stomach, is a recipe for gastritis and eventually ulcers. Excessive alcohol consumption is brutal on your stomach lining. Alcohol directly irritates and erodes the mucous membrane, increases acid production, and impairs your stomach's ability to repair damaged tissue. Even moderate drinking can trigger gastritis in susceptible individuals, and heavy drinking almost guarantees it. Chronic stress is a huge but often overlooked cause of gastritis. When you're stressed, your body produces cortisol and other stress hormones that increase stomach acid production while simultaneously reducing blood flow to your digestive system. Less blood flow means less oxygen and fewer nutrients reaching your stomach lining, impairing its ability to maintain its protective barrier and heal damage. Autoimmune gastritis is less common but worth mentioning. In this condition, your immune system mistakenly attacks your stomach lining cells. This type typically affects the upper portion of your stomach and can lead to vitamin B12 deficiency over time because it damages the cells that produce intrinsic factor needed for B12 absorption. Bile reflux can cause gastritis when bile from your small intestine flows backward into your stomach. Bile is extremely irritating to stomach tissue, and chronic exposure causes significant inflammation. This often happens in people who've had certain types of stomach surgery or have problems with the valve between the stomach and small intestine. Now here's what happens when you ignore gastritis and just keep pushing through. First, acute gastritis becomes chronic gastritis. What started as temporary inflammation becomes permanent changes to your stomach lining. The tissue starts developing abnormal characteristics, and the inflammation becomes self-perpetuating. Chronic gastritis significantly increases your risk of developing peptic ulcers. These are actual holes or deep sores in your stomach lining. Ulcers cause severe pain, can bleed, and in worst cases can perforate, creating a hole completely through your stomach wall. This is a life-threatening emergency requiring immediate surgery. One of the most serious long-term complications of chronic gastritis is an increased risk of stomach cancer. Chronic inflammation, especially when caused by H. pylori, can lead to changes in stomach cells called metaplasia and dysplasia. These are precancerous changes that can eventually develop into gastric adenocarcinoma. I'm not trying to scare you, but you need to understand that stomach cancer is one of the deadliest cancers because it's often caught late. The early symptoms of stomach cancer look exactly like gastritis, burning, discomfort, feeling full quickly. By the time people realize something is seriously wrong, the cancer has often progressed significantly. Chronic gastritis can also lead to atrophic gastritis, where your stomach lining becomes thin and loses its normal glandular structure. This impairs your ability to produce stomach acid and digestive enzymes, leading to malabsorption of nutrients. You start developing deficiencies in iron, B12, and other essential nutrients even though you're eating well. Pernicious anemia is a specific complication of atrophic gastritis affecting the part of your stomach that produces intrinsic factor. Without intrinsic factor, you cannot absorb vitamin B12 no matter how much you consume. B12 deficiency causes fatigue, neurological problems, and can lead to irreversible nerve damage if left untreated. So what do you do if you recognize these symptoms in yourself? First, stop ignoring them. I know it's tempting to just take an antacid and hope for the best, but that's not addressing the underlying problem. Antacids provide temporary symptom relief, but do nothing to heal the inflammation or address the root cause. You need proper evaluation. This typically means seeing a gastroenterologist who can perform an endoscopy if necessary. An endoscopy allows the doctor to directly visualize your stomach lining, see the extent of inflammation, take biopsies to check for H. pylori and rule out more serious conditions like ulcers or cancer. Testing for H. pylori is crucial and can be done through blood tests, stool tests, breath tests, or biopsy during endoscopy. If H. pylori is present, you'll need antibiotic treatment to eradicate it. Natural approaches can help support healing, but active H. pylori infection typically requires antibiotics for complete eradication. While you're waiting for medical evaluation or alongside medical treatment, there are immediate steps you can take to stop making your gastritis worse. First and most important, eliminate NSAIDs completely. Find alternative pain relief methods. Talk to your doctor about options that won't damage your stomach. Stop drinking alcohol, not reduce it, stop it completely during the healing phase. Your stomach cannot heal while you're continuously irritating it with alcohol. Once your gastritis has healed, you might be able to tolerate small amounts occasionally, But during active inflammation, alcohol is off limits. Address your stress. I know everyone says this, but chronic stress is literally destroying your stomach lining. You need to implement actual stress management practices. This means daily meditation, breathing exercises, yoga, therapy, whatever works for you. This isn't optional if you want to heal. Your diet needs immediate changes. Eliminate all the inflammatory foods we've discussed in previous videos. No gluten, no sugar, no dairy, no spicy foods. I know this seems restrictive, but your stomach is inflamed and needs a break from anything that triggers further irritation. Start implementing the healing protocols I've shared in my other videos. Cabbage juice, potato juice, aloe vera, bone broth. These aren't just nice additions. They're powerful healing tools that can significantly accelerate your recovery when used consistently. Small, frequent meals instead of large ones. Your inflamed stomach cannot handle large volumes of food. Eating smaller portions more frequently reduces the workload on your stomach and minimizes acid production spikes that cause pain and further damage. Chew your food thoroughly. The more mechanical breakdown that happens in your mouth, the less chemical breakdown your stomach needs to do. This means less acid production and less work for your already struggling stomach. Stay upright for at least 3 hours after eating. Lying down too soon after meals allows stomach contents and acid to flow back toward your esophagus, potentially causing additional irritation and reflux symptoms. Elevate the head of your bed. Even a few inches of elevation helps prevent nighttime acid reflux, giving your stomach a better chance to heal while you sleep. Avoid tight clothing around your abdomen. Pressure on your stomach can force acid upward and worsen symptoms. Wear loose, comfortable clothing, especially around mealtimes. Here's the bottom line. Your stomach is not your enemy. It's trying to tell you something is wrong. Those symptoms you've been ignoring are not just inconveniences to push through. They're warning signs of inflammation that will get progressively worse if you don't address the root causes. Gastritis is highly treatable and often completely reversible if you catch it early and take appropriate action. But the longer you ignore it, the more damage accumulates, and the harder it becomes to fully heal. Chronic gastritis creates changes that may never fully reverse and significantly increases your risk of serious complications. I've seen too many patients who waited until their symptoms were unbearable before seeking help. Don't be that person. If you're experiencing any of the symptoms we discussed today, especially if they've been going on for more than a few weeks, you need to take action now. Your health is not something you can put on the back burner while you deal with everything else in your life. Your stomach is the foundation of your overall health. When your digestion is compromised, everything else suffers. Your energy, your immunity, your mental health, your ability to absorb nutrients, everything depends on a healthy digestive system. If this video opened your eyes to symptoms you've been ignoring or helped you understand the seriousness of gastritis, please give it a thumbs up and share it with anyone you know who's dealing with digestive issues. So many people are suffering unnecessarily because they don't understand what's happening in their bodies. Make sure you're subscribed and have notifications turned on because I'm constantly sharing detailed information about digestive healing, natural treatment protocols, and evidence-based strategies for overcoming chronic gastric conditions. Remember, your stomach is not throwing hands because it hates you. It's fighting for your attention because it needs help. Listen to what your body is telling you and take action before temporary inflammation becomes permanent damage. I'll see you in the next video.